All right, our recording is now in progress. Did you guys hear that little? All right. Well, hello and welcome everyone to our live. Today we're going to be talking about ADHD and other mental health conditions that overlap, and some that might be confusing and convince us that we have ADHD when we actually have something else. And then I have brought on two guests with me today who both have ADHD, just so that you guys are going to hear about the personal experiences that they've had, different styles of dealing with the ADHD that they both have. So again, welcome. I'm Dr. J, if you haven't met me before, but you are obviously in my community, so you know who I am. So welcome everyone. Let's start with Dan in the top left. Give us a little introduction to who you are, because we now know in the chat that you are in fact my husband, but tell us a little bit more about yourself so that they understand, and then we will hop over to Eden.
Well, in the context of being a panelist for an ADHD discussion, I am a lawyer. I was diagnosed with what would be classified as pretty severe ADHD at a very early age by a clinical psychologist, which was manifest as a result of an investigation into basically behavioral and like energy problems. So I was extremely difficult and disobedient, but that also was cross-diagnosed with a high IQ or a gifted status, which I understand is relatively common. I resisted medication throughout my entire life and only began taking medication within the last year as a basically experimental thing. And I find the presence of ADHD in my life both a blessing and a curse, and at times something that I barely even acknowledge or address.
Yeah, we'll get into the details about that later, because not only do we have this wonderful human here sharing his experience with great vocabulary and education and discernment, but we're also going to get the nitty-gritty details on my end of what it's also like experiencing and being in a relationship with someone who has ADHD, which I know is going to be a banger for those of you listening. Let's move on to Eden right now, just so that you can share a little bit about your ADHD, because obviously your experience is different, both as a female, but also your treatment path that you've taken over the years. So
Sure.
Introduction, please.
Great. Hi, everyone. Yes, my name is Eden, like the garden. That's always my introduction. And I always say, I'm ADHD, if you haven't noticed. That's usually the intro I lead with. So also known as the Energizer Bunny. That's always been my nickname. You'll know after 20 minutes or so with me. And I can say with pure confidence that Dan is probably the only other person on the planet who can understand the rate at which I communicate at and actually digest every single word and repeat it back to me. So I think that's like an ADHD telepathy that we have going on. But yes, so my name is Eden. I'm a recruiter, so I'm in the business of talking to people, which is consistently all the more reason to bring out my ADHD and just points that I'll talk about there and how that relates to it and brings it out. My parents tell me that when I was born, I came out going like this, just looking around. So I truly believe that this is something I've been dealing with since very, very early stage, before I recognized my own behavior and chaos that I felt inside and just the way that I went about my everyday life. Actually decided to go for the evaluation only once I was in university. And that was when I really put a label on it, on being ADHD. And then from there, spent a lot of time trying to navigate kind of the best way to deal with it, which still is something that I am working on, but engaging in a lot of these conversations and utilizing Jenna as a really strong resource for understanding and my behavior, and then how it affects everybody around me, and then how to actually navigate that and almost use my ADHD as Dan said it perfectly. It could be like a blessing and a curse, but learning how to use it as almost like my secret weapon, and understanding where it enhances certain areas of my life and where it makes things challenging for myself and others. So it's a little bit about my story. I'm really excited to be here. So thank you.
Yeah, and just for context for everyone, this is my husband and my best friend. So I am like surrounded by people with ADHD, I have learned to accept the blessings as big blessings, like they're saying. And everywhere where I've felt from a doctor's perspective that it was a curse, I have tried to work with both of them on where we could improve different areas of their mental health so that we were reaping the benefit of the blessing and also reducing the impact of the curse. So I would say I have a nice toolbox, and it's also hard to treat people that are close to you. So I would say I've dabbled with them where they're not actually my patients, but we're trying different things so that when it comes to my patients, I actually have that better skill set and I know how to incorporate treatment plans, how to engage with them, and how to motivate them because both of these two have very different brains than me. They have very similar brains to the patients I work with that have ADHD. So it has been a big, big help for me. I do want to mention, I know I've talked about this before, I think we started recording, but men and women have very different presentations of ADHD. So we are going to get into those details right now. All right. So Dan, you mentioned prior that you don't think that ADHD has really affected your life or you don't really notice it as much. But can you give us just some overview if you're going to be, as honest as you possibly can? How do you think ADHD has affected your life? Let's talk about course of life. Let's talk about job life. Let's talk about personal life. Just talk about how you think it's actually affected you versus where you more so didn't notice it.
So I'm going to reframe what you said because it has affected my life immensely in immeasurable ways. Again, in some respects for the positive. Probably on a balance of probabilities toward the negative. When I reference the potential experience of it, I don't notice it or I don't consider it to having a major impact at times or, throughout my experience. It's my experience of my mind, how my mind works as all subjective experience for everyone is that this is my normal. So it's a lot of the things that I go through, say, for example, difficulty concentrating, being capable of doing literally 10 to 15 things at the same time. That to me it's not presenting as a issue or condition because it's what my experience has been since I have a recollection of experiencing. Your question had two parts. I've already forgotten to some degree what the second part was, which again is a manifestation of the condition, but again is such a normal thing for me. The forgetfulness, the an immense amount of memory on certain things, specific things to me, and the lack of memory on other things, like being asked a question that I wasn't paying attention to because it didn't matter to me, kind of thing. That's the component of it. But I think if I can recall, what you were asking me was how it's impacted various avenues of my life. Is that a good paraphrase?
Yes.
Okay. So I would say in terms of growing up, in terms of education, it was, again, a major hindrance, but also a blessing. So the inability to concentrate in the same fashion that somebody else might be able to created difficulties with relationships. It created difficulties with behavior. I didn't want to sit still. I didn't want to be where I was. I would be doing a million things, doodling, listening to music, reading other books, focusing on things that interested me. However, because of the capability of focusing on so many things and having a higher than average intellect, not a pat on the back, just a stated fact, I was extremely successful in academia. So I would get A pluses, 99%, 98%, even in courses that I had zero interest in. I was reading comic book and drawing books and listening to music, etc. Professional life, it's probably been the biggest hindrance because you can get away with a lot in your adolescence and even in university that you can't get away with as an adult. So I could get away with not paying attention and doing whatever it was I was doing and still pull a 99 and appear to the outside world as being immensely successful. In the professional context, performance and output is everything. So it takes me double the time that it might take somebody else to do a very specific task, because I'm doing 20 other tasks and I'm taking breaks and I'm listening to this and I'm stopping that and I'm having a conversation here and I'm texting there. So it's, I would say, on a preponderance of percentages, much more negative in the professional sphere and requires a lot of effort and consciousness. And then in my personal life, I would say it's probably right down the middle. Some people would say awful. Some people would say good. I have very good, close, intense relationships. I have very poor connections with my relationships. You'll text me, I'll look at the text, I'll forget that you've texted me 1.2 milliseconds later. I won't respond to your text. You'll be offended. You'll call me, you'll tell me you're offended. I'll say you shouldn't be offended and that I didn't experience that way. And that person won't text me again for 6 months. And I won't notice they didn't text me for 6 months. And when they call me 6 months later, they tell me that they're offended that they hadn't texted me in 6 months and that I didn't notice and that it hurt their feelings. And I say that it shouldn't. And if they wanted to reach out to me, they could have. It's difficult in personal relationships, and the degree to which the close relationships you have in your life are conscious of and creative in their approaches to you, like my wife, my mother, it is an immensely beneficial component. To the extent your relationships aren't willing to acknowledge it, address it, or work with it, it can create extreme difficulties and conflict within that relationship.
Mm-hmm. All right, Eden, let's pivot to you for a second. Tell us how ADHD has affected your life, both in these same realms. And then I'm going to bring up a little misconception that we generally have about ADHD. So you go for it.
Yeah, I just want to say it's so interesting because especially when we talk about the differences in like men and women and how ADHD can affect them differently, there's such a comfort in listening to like Dan talk and be like, oh my God, I have that too. Like there's almost like a language aside from the way we actually speak, but experiences that are so parallel and aligned to each other that it's like, oh my God, there's so many people that have these same everyday struggles and scenarios in their personal and professional life, which is just really, really interesting. So, can
I just interrupt you? Can I just interrupt you for 1 sec?
Sure.
I also want to note that I love being able to actually share it because it does feel so isolating to experience these things when you're not. And I also want to point out that both Eden and I are consciously slowing down our speech by at least 30 to 40%.
I was just going to say, like, for my listeners who are used to hearing me talk a lot and like I'm always the one adding the things and interjecting, I was going to be like, hey guys, sorry about this. You're not going to hear a lot from me today. I'm being joined today by two speed talking, interrupting, crazy, loving people. So I'm going to have to really fight for my chance to talk today. Eden?
I would just like to point out that it is polite and well-timed interjection.
Eden, take the floor.
The floor is mine. So, I mean, I guess I can start just from a personal experience and how it's really affected my just growing up and how I actually navigated that and like the discomfort of like what I'm feeling versus like what everyone around me recognizes. Like I was always the hyper kid. Like my parents would go to parent teacher interviews and I don't even remember this. Like from a very early age, elementary school, the teacher would tell my parents that in the middle of class, I would get up and walk around. I don't even remember doing that because now I'm like the audacity, like a teacher's teaching and I'm getting up and walking around. Like you can find me at any dinner table, like making a napkin into confetti or like the straw is now like I'm always fidgeting. And
Dan does that too. He always rips shit up like a dog.
It's like confetti, like a 5-year-old at a table. But so in our generation, growing up at a time where like you were the hyper kid and when you're the hyper kid or you got to slow down, you got to, talk slower or do this less or be less of what you're doing. I feel like we were just taught to like sit in the corner and have our face to the wall. Whereas now I'm like, someone should have just put me in a backyard and had me just run around because I would have probably been more productive after 20 minutes of that than just like containing that energy that I had. Yeah. So it really affected me in how I learned and like I feel like now there's so many different approaches to like inheriting information and learning in professional and personal environments. So I find I've always had that constant need to like be stimulated, whether it's needing to just talk or be stimulated in a learning environment. So university was very challenging for me because to sit in a lecture, go home and read a textbook, to me is like watching paint dry. Like I need to be doing something active in order to really inherit and digest that information and apply it to what I'm doing. And as Dan highlighted, the memory, like I have got the most killer memory in some aspects of my life that people are like, how the heck do you remember a detail like that? But then on the other hand, it's like the smallest little things you absolutely just forget. And then it's just a continuous cycle. So that's always been a really big part of it as well. As far as professionally, for me, I along with that need for stimulation and attention, I've constantly always found myself in environments where there's high urgency, high performance, and it's difficult to navigate this. I'm in like a corporate environment, so I do work behind a desk, but I'm constantly working at a much faster rate than everybody around me. Like I have a colleague of mine who's like, Eden, I don't know how you do that just as quickly as you do. And like, you got to slow down because like, I can't even understand what you're saying, or how did you already send that? Like my brain is working 100 miles a minute. And there's such this like rapid need for this need for urgency in everything I do. And that's why I always find myself in like that environment in the workplace as well. It almost like satiates that need, which is interesting. But I must see me already forgetting my train of thought, but there is the other thing that I also notice as well is just this like sometimes these moments of just like really feeling chaotic. And granted, I'm a person who navigates anxiety and ADHD, so it's interesting to see those parallels and like recognizing or misdiagnosing one for the other, or like I'm sitting at my desk all day, so 6 o'clock hits and I'm running around the kitchen and I'm washing the pan and I'm making dinner and this thing's open and I didn't put this thing away and the TV's on and there's 100 million things going on at once. And there's that feeling that like I forgot something, or there's something that's like sitting in my brain I need to do, but I've forgotten what it is. It's like that constant feeling of chaos, and then feeling like I need to just go run a 100 miles race.
So this is where we're seeing those differences between you and Dan, because you have that pure anxiety overlap, the go, go, go. Dan doesn't, and we're going to talk about how his brain is a little bit more abstract and neurodivergent than yours, because you do have the, it's almost like feminine energy. He will get it. He will get the need to do everything and be like, did I miss something? I got to do this. But his is, yours is more chaotic and forgotten and speedy. Whereas Dan's is more like, think about 5 computers running at the same time, and there's actually an equal awareness of all of them at the same time. And this is where I see ADHD diverge, because he's saying like, yeah, he forgot something silly, like he left his coffee on the counter. But if there's 10 things that need to be done, he's so equally invested in all of them at the same time that it's not chaotic energy. We're seeing it as like, if I was a normal person and I was doing something, I'd be like, that's a lot to focus on at the same time. Like finish one task, do the next task, do the next one. He actually can only operate when he's doing all of them at the same time, because his brain needs to be neurodiverged so that he's doing all of them at the same time in order to be able to focus on the one thing. So it's different than yours because you have more of the anxiety component. I would say in general, Dan's not an anxious person. He doesn't have the anxiety diagnosis component that I would give to someone like you. So it's so interesting to watch that overlap, because we're going to talk about a lot of his different diagnoses that, we've together been like, oh yeah, that actually makes a lot of sense that you might be working through that. And we're going to see which ones are new for you, because me and you don't talk about the ADHD as much as we talk about the anxiety for you personally. So yeah, that in regard to what Dan said at the beginning, ADHD people don't usually have racing thoughts or crowded thoughts in the same way that anxiety or bipolar kind of get this like chaotic thinking. But what they do have is they have like these multiple thoughts at the same time, which actually feels so normal that it's the same way as me thinking in chronological order. Does that make sense?
Yeah, just to add that, right, just to that, like right there, the best example is like me telling a story is like, I tell the story and I'm taking like, I've got to get to Florida and I'm stopping at 100 states along the way. Like that's what my brain does. And it's like, how did you get from there to there, but then go there at the same time? So that is exactly the depiction of what it is like.
Neurodivergence. And that's the newer term that we call ADHD from a mental health perspective, is a neurodivergent brain. So we kind of just covered the anxiety overlap for you. Let's cover some overlap for Dan, because I think when we bring it back to his childhood, there's some very big determinants right there that we're like, oh, that's a pure diagnosis. So while he has ADHD, and I don't think this was actually the wording they used back in the day, but oppositional defiance disorder is like a huge overlap with ADHD. And for those of you who don't know what that is, it's like you can't function in a relationship where there is authority or where someone is telling you what to do, because your brain actually cannot see eye to eye in that type of situation, and it causes a behavioral outburst. So Dan, can you talk about how that showed up as a kid? And then let's also like have a funny conversation about being husband and wife and how it shows up in adulthood with that overlap for ODD.
So I would agree and disagree. So I think that it probably is a frequent manifestation, and it does exist and it's present within myself. However, in contrast to that, there is a extreme desire to and willingness to follow authority and to please authority when the authority is respected or the authority is in agreement with my own level of thought.
Okay, so can we pause for a second there? But that's the exact thing that I want people to recognize if they have ODD, is it's the oppositional defiance disorder. If someone is against them, that's when the emotional exacerbation occurs. So if there's an authority who's aligned with you, there's a lot of respect. But if it's a person who has that differing viewpoint or differing request or differing opinion, it's more challenging there.
Yeah, and that is a really, really good clarification to it, because in the context of, let's say, for example, someone who is teaching me, like a teacher who I value, who I have identified as being intelligent, who I have identified as being someone who can impart knowledge, wisdom, and direction for me, the level of compliance and obedience and desire to please is so out of proportion to what would be considered within the norm that it actually creates such a degree of success because you're willing to do almost anything in order to get there. Mm-hmm. On the opposite side of things, if I am confronted with, let's say, for example, a teacher who I deem to be stupid or dumber than me or having opinions of less value, the extent to which I can show them contrition and be contrite with them and
very oppositional and very defiant,
disrespectful, and just completely like, you're completely and totally wrong on everything and anything that you are and existing as a human being. It's very strong.
Right. Now, I also want to really highlight this for a lot of people, because I think when people have this, like if they have ODD and ADHD, they blame themselves. They're like, I wish I could be a better person, or like, I wish I could work on that. And I want you to be genuine and share with people, like, you do try to work on it. Sometimes you just can't see that, like you can't see the eye to eye, or you can't concede. You can't like, I want to describe it almost like a handicap. But once you see it as a symptom, there's a lot more understanding around it, especially for me as a partner in a relationship. Sometimes I can see when it's a symptom that's being exacerbated versus a me problem or a you problem. Does that make sense?
Yes and no. I actually like the when you tied it into the personal component of our relationship, I would say far more so. So you know, I think it manifests differently in each individual person because I'm extremely empathic. So on that side of the spectrum, I actually am, you know, probably way out of balance on that. So it does help to soften it at times. Yeah. But when I have identified that I don't care to work on it, when I feel righteous in that manifestation of the diagnosis, it's not made with awareness, and it's made with absolute certainty. So it's, if I have dismissed someone as stupid or not intelligent or not thinking about something correctly, if I feel correct in that assessment, there is no empathy for them and there is no softness to it. It's not I am being tough on them because of my diagnosis. It's they are genuinely not going to be engaging with me because there's no reason to. And
Okay.
I feel absolutely righteous and justified in that.
So would you call that a blind spot?
Perhaps in certain contexts, if it was pointed out that it might have been disproportionate, I could identify it as a blind spot. But in other circumstances or in other situations or with individuals, I would say absolutely not. I'm completely and totally fine in the manner in which I have conducted myself. There won't be rumination on it. There won't be guilt associated with it. There won't be anxiety of, I can't believe I treated that person as such. I'm just like, no, I'm good.
Right.
Moving on.
It's a good thing we have Eden here because she's like sitting there listening and then she's realizing, okay, I'll have the same behavior and same actions, but because of her anxiety overlap, she'll swing in the opposite direction so vastly that she's like gets lost and then there's more chaos. So Eden, why don't you talk about how the oppositional defiance in you, how it would come up, and then how the anxiety overlapping with the ADHD makes it a terrifying experience for you.
It's almost like I have like 100 people, and this is going to sound like a completely different topic, but it's like there's 100 million people inside my head right now, and there's like the emotional brain, the logical brain, and then the pace at which it's all happening, and then the rapid flow of like intensity and emotion. So it's just like
we're going to talk about that next.
Yeah, that's just like the ruminating thoughts, like for me has always been something that exists, especially in conflict, and like you're dealing with that, navigating that, and then like the heart rate that just completely just starts picking up the pace. And when you're dealing with a situation, whether it's a romantic partner or a friend or whoever it is that you're in that conflict with, it's just like it's so hard to understand like how to almost feed both and what they each need, of like the anxiety and the ADHD. It's like, how do I separate this like sensation I'm feeling and understand like what it needs to be able to allow me to function and come down from it? For me, it's like this feeling of like coming down from it, which like a lot of the times how I navigate that is like picking up the phone and calling Jenna, who can like understand. Like, I feel like we spent so much time having these conversations and growing up together that you can actually look at me and evaluate, like, I can see what's happening in your brain right now. And I can see how you're having this like physiological response. But it's really interesting to look at that like combination of how the anxiety bleeds into the ADHD, and just in a conflict, especially because the anxiety is more about like, and that urgency and impulse kicks in of like the fear of loss and worrying about the worst and needing that certainty and whatever that is triggering that anxiety. But the ADHD is also like then almost how you're dealing with it and responding to it. So it's like the
let's also talk about how hard that is. No, I'm going to interject. I see Dan trying to interject with me. Don't do it. I'm the doctor here. All right. We're talking about you, Eden, trying to logically separate your anxiety and your ADHD, as if you're not a neurodivergent human who can actually separate these two things, right? So that's the, and I'm going to swear, and people know I swear, but that's the mind fuck, right? Is we're trying to separate as a logical human with a human that doesn't have the logical capability to not do this, right? And if you're not watching the video right now, my arms and my hands are doing neurodivergent mode, right? So people with ADHD, when they have these other mental health conditions, have to process it so differently than Dan's giving me eyes.
No, please finish.
Okay, like it's just the processing for you is not as simple as, you know, me talking to someone who has anxiety and depression and getting a walk through them logically, because ADHD is processing the information very differently, which I've had to learn to acknowledge over time, is they're not seeing it the same way that an average brain is seeing it and feeling it and experiencing it.
My interjection was almost identical to that, just in that it's not the anxiety that is the manifestation of the ADHD. It's the secondary diagnosis of anxiety and how that's processed by the person with ADHD. So I have other issues that get processed differently because of my ADHD than people who suffer from those other issues.
Exactly.
Whereas with Eden, it's the anxiety component and how that impacts that. And for both of us, and I would imagine for almost anyone with ADHD, one of the primary things that causes the problems of our other diagnoses or whatever it might be in our personality, which then gets magnified or created in a different framework because of the ADHD, is stress response. And like whenever I am under pressure or under stressors, that exacerbates all of the other symptoms associated with anything else that I have going on, including ADHD, my coping mechanisms, my short-temperedness, whatever it might be.
Which we'll talk about.
Yes, I know.
So I want to pause
figured.
for a second because we're talking a lot about ADHD and anxiety right now. And I want to acknowledge that there's a lot of people out there who have ADHD who also lean to the depression side. And the reason why we see a lot of that is because the isolation that comes with ADHD, the processing of emotions when it comes to the ADHD, and also a lot of the shame and the guilt that comes along with not being able to execute the way you want to. So one of the big problems, and I want to highlight this moment, one of the big problems that we see with ADHD is executive functioning, which means your ability to process and then the actual motivation and execution to do what you need to do, right? So you can like sit in that phase of being chaotic and thinking about what you want to do, but and know how you want to make change, but you actually can't get to the other side because of the lack of executive function, which is actually a brain state that we see with people who have ADHD and neurodivergent brains, which is why I have so much compassion and understanding for when my husband can't execute something that I need him to do. All jokes aside, this is actually a very, very big thing that leads to lack of self-esteem and feeling uncomfortable in your own skin and not being happy with who you are because you have all these goals and desires and you know that you want to achieve them, but you can't figure out how the fuck you're going to get there. Every time you want to try and get there, you're like, oh, I can't, and I'm a failure, right? So there's this huge overlap with like the ADHD, the depression, the anxiety, and then my high achieving people. Because a lot of people with ADHD are super high achieving, but they can't get to the end goal, which makes them lose self-esteem and like hope in themselves that they're ever going to be able to do it. Which is really detrimental for the psyche and like your emotional state, right? So how do you guys feel when I bring that up? How would you say that your executive functioning or your high motivation but lack of execution is present on a daily basis or goals wise in the future?
So what I think is interesting about that is for me, that's like, I can't think about that without thinking about the anxiety component of it, because the ADHD makes me kick it into overdrive and have high urgency and like execute and act. But the anxiety is like, almost with the anxiety, it's like for me in high points of anxiety, it's like that crippling feeling of like not wanting to do whatever it is, or like ruminating over what it is, or thinking about something being this way or that way, or like whatever it is that you are actually fearing or being triggered by. But like the ADHD is what makes me feel like I need to just be in a million places at once and be doing, which sometimes it works, especially with my job, because I'm in such a high urgency, high performance environment. But on the other hand, then you lose attention to detail and you sacrifice certain things or quality of some things because of that need. And that's just the way that my brain functions.
Well, you're double dutying. You have the high motivation, and then instead of just having the lack of execution, you have a subset of issues in between that are very reasonable and logical reasons why you can't get to the goal because you have the anxiety in between. Dan,
Sure.
for you, when it comes to high motivation, lack of execution, I don't know if there's a lot of like mental capacity in there for you being like, oh, I can't do this, I shouldn't, but what about this, what about that? How does the drop off happen for you? Like, let's say you have that high motivation to get something done, and then it just gets lost in translation.
I mean, the high motivation, like when I would say it's a constant, like you said, reorganizing of the computer system, determining and prioritizing what to do. And often what ends up happening is an item that may actually not require prioritization becomes so hyper focused and so necessary to complete to the maximum degree humanly possible that it results in putting off the item that was or should have been prioritized, and there can be an anxiety or a feeling of kind of it just kind of keeps getting put down the line, and there can be almost a procrastination about doing the original thing, which required the most priority, in order to continue putting things that did not have priority ahead of it.
Now, here's a question. Because procrastination is like one of the most highly stated symptoms of ADHD for important stuff. When we say important, we mean like things with a due date or things that should be done versus like getting involved in listening to a history channel or cleaning a dish or, you know, deciding you're going to reorganize the house, whatever it is that you get hyper fixated on. But procrastination is like a huge thing. And I want to bring up the fact and the evidence that the reason why we have that is because that thing that we're getting fixated on is novel. It's fun, it's new, it's exciting in comparison to the thing that has to get done. And that's like a really big descriptor of when we have that ADHD. It's not just plain procrastination. It is high motivation for something that's novel and fun and cool, and a really low motivation for something that's mundane and boring and something that we just know has to get done. Even if there is a due date or if there's pressure to get it done, if the novelty is not there, then we have a little bit of an issue. And that has to do with dopamine in the brain, which is when we look at the chemical components of ADHD, we have a brain that is never satiated from dopamine. The need to have the reward, to have the excitement, to have the end goal. We want to be always releasing that dopamine inside of our brains, because in your brains you have receptors that it's never enough, right? And I call, for everyone listening, I call Dan the disease of more. He always needs more. There's never enough satiation because the dopamine is never getting uptaken by its receptors and being like, we're good. Because the dopamine is, think of it like floating out in the ethers, and it's just not getting received by anything. And there's so much being given, but it's not being received. Okay. So how do you guys combat novelty? Like, let's say you have to get something done, you know it has to get done. Do you guys have a way of fudging the system so that you make the task that you need to do more fun or more novel so that you actually get it done?
I mean, I just think of a simple example of my everyday, like, let's say I need to send an email or do a write-up or something that I'm doing. And then on another tab, I've got Nordstrom pulled up and I'm looking for a pair of heels to wear to a wedding I have next month. Like, that is literally an example of something I'm doing today where it's like clearly low urgency and importance on that, but it's like the fun, it's the shiny objects appeal, right? It's not like, it's almost like it's like, I've got this to do, but I'm going to do a side peek and go here. But then for me, it's hard. It's like, oh, but the anxiety kicks in about having to get that done. And then it's almost like, for me, it's like, okay, I have to create an environment for myself or like put some sort of restriction or discipline on it so that I get it done. And then it's like, okay, I can see that as a reward. So if it's sitting at my desk and knowing I'm just going to power this out and get it done and play some music in the background, and then I can have 10 minutes, or I'll wait till I have my lunch break so that when I'm on my lunch break, I know I don't need to get sidetracked by anything. I can use this 20 minutes to do whatever it is that I wanted to do and actually make time for that. And then I'm not ridden with the guilt of that afterwards.
Yeah. And for people listening, this isn't like, oh, take a break when you're studying so that you can be refreshed. This is like, people with ADHD genuinely need to give themselves a dopamine hit in order to achieve the thing that they need to do. So you guys, if you have this neurodivergent type of brain, are going to have to strategically figure out how you're going to find novelty in basic day-to-day things so that your brain feels like it's actually getting what it needs. I know Dan's really good at this. So Dan, what do you do to satiate your dopamine hit that you need in order to get through day to day?
It's eerily creepy to listen to Eden just explain that scenario, because that is identical to what I have always done, what I do. I would say I potentially do it worse. When I was younger, I was better, but the reward system is like I'm going to do 20 minutes of homework and I'm going to reward myself by playing an hour of video games. That was like when I was a kid. Okay. So, and then I would bang out that 20 minutes of homework to like perfection, and then I'd get that hour of, and like I'd create these reward systems in my brain. It's diseased. And then
Dan
as
loves
I got
a gold
older,
star system.
then as I got older, one of the things I do, which is also problematic, is I'll build more time. So again, same stuff as Eden, but I'll build more time into my day. So I'll get up at 3, 4, 5 in the morning, so that I know that I have an extra 4 or 5 hours of my day, because I know, what would normally take 3 hours to do if I sat there and did it, it's going to take me 6 hours to do, because I'm going to be doing all these other nonsense things in between. Also, and I'm sure Jenna will like this tie-in, the reward system changes as you get older, and you start to do things that may or may not be beneficial to you in order to get your dopamine and to reward yourself.
Okay, so lots of people that are going to listen to this are already in your age bracket, A. B, a lot of people are having this issue where they are leaning toward other things to get their dopamine. So let's talk about the dark and twisties of needing dopamine and what happens when your, let's call it day-to-day gold stars aren't actually giving you the hit that you need. And you don't have to go like dark, but like go like a little dark, just so that people feel heard and validated and understood, and how ADHD has that overlap with substance use and has the overlap with impulsive behaviors and that kind of stuff. Okay.
I'm going to take this one, Eden.
Yeah, it's funny though, because I was actually about to say something about being impulsive right before you said that, but share that.
And just hold on, for context, Dan has behavioral impulses and Eden has emotional impulses. So we're going to get this nice, vast, broad explanation of what those both look like. So Dan, you take the floor first.
Yeah, I would say emotionally, I'm, for the most part, really relatively well regulated, subject to momentary, outbursts that everyone is subject to. My impulsivity and my dopamine desires tend to take the form of, and from my understanding is very common, substance abuse issues. So for example, alcohol use, other substance abuse components, but it's not uncommon, from what I understand and from my experience with other people who have ADHD, to supplement with that daily reward. Food is another one people often overeat or overindulge. Spending is another one that I've heard is extremely common, like just like wild spending for no particular reason on absolute nothing burger. All of these things, it's, well, I worked hard this week. I did what was expected of me this week. I've met my, quota of, required responsibilities. Now I get to X. Now I get to Y. And even if X and Y is horrendous, get to do it, want to do it, I'm going to do it, I'm going to do it the most.
Yeah. And I think that a lot of people, there's a misconception that because you have ADHD, your brain's so busy and it's so chaotic that you need to like use substances like alcohol and drugs to calm yourself down. But that's really not what's happening. It's not that you're using it to like dissociate and calm down and let go. It's that your body genuinely needs more dopamine. And there's only one way to do that when you've exhausted all of your sober efforts, right? And I guess that can be a slippery slope to slide down. But I think that it is validating to hear that you have the natural vulnerability when you have ADHD to lean in that territory. And for those of you who are watching the video version right now, Eden is nodding her head right now because there is a reason that this girl doesn't touch substances whatsoever. Eden is not an alcohol drinker. She's not a drug doer. She is a completely clean, in that territory, because I think that she knows that devil on her shoulder will come for her if the time was ever, available. And she doesn't tend toward that path, but she has also some crazy impulsivities emotionally that she needs to scratch her itch on to get her dopamine. So let's pass the floor over to her so that she can explain from a relationship perspective, even like just friendship wise or romantically, but how you need to get your yayas out for your dopamine.
No, it's so true. And yes, as you see, I'm a head nodder. So like, it's like, yes, I feel that. Yes, I see that. But impulsivity is big for me. I find myself in this constant cycle of impulse, instant gratification, guilt. That is the way that my brain operates, like this high state of euphoria and excitement. And then the feeling for me, impulse, it is with shopping. I mean, never to like a crazy outrage. Like I'm not going to go out and randomly decide to buy a Ferrari. I mean, let's be real, I'm not buying a Ferrari, but like, I'm not going to go and be stupid and go buy like an outrageous purchase, but like very impulsive in that regard of just like easily convincing myself into something. And then that instant gratification and feeling of like spending in something and having something material. And then the guilt. the guilt of, oh my God, should I have not bought that? Should I have not spent that? Do I need that? I just go through this constant cycle.
Well, that's your anxiety component, because I'm going to confidently say, I don't think Dan has the guilt flex. I think that he does the thing. Oh, you do? Oh my God, tell us, share.
At times, depending on what the thing is, 100% there is a guilt component, particularly, listen, when you're smart enough and you're conscious enough to know what it is exactly that you're doing. So if you're filling the void, so I used to be obsessed with working out. So when you're filling the void with a positive input, you don't feel the guilt. So I didn't feel the guilt about filling that need with working out or something like that. The guilt comes if I, drank, half a bottle of whiskey with my buddy that night, knowing that I could have very well had, a glass of whiskey, and that would have been more than sufficient to have a lovely evening. And then I'm tired the next day, and then I'm like, why would I drink that much? I now I'm not as functional. That like there
Right.
for
But
sure.
the impulsivity and the acknowledgement of the future consequence never stops you. And that's the executive.
Rarely.
That's the executive functioning.
Rarely.
Right. Like, for example, me and Dan went out last night. Dan has probably slept, he's yawning right now. He's probably slept a maximum of 12 hours this whole week. It's Friday. And that's because he's very stressed. And now we're going to watch, ADHD play itself out. But we went out last night and we could have, had one drink and left and gone home early and done what we needed to do. But when you start to engage in something that you find novel and fun, you like go, more. And you're not able to put the stop factor on it, even though it's bad for you. So it's an impulsivity problem, and it's not that you don't know what the outcome is. It's that you genuinely can't make a good decision for the future because the dopamine hit is so important in the now, right? It's a big handicap. But I mean, you handle it really well. And so does Eden. And I want to pivot just for a second to talk about the things that you guys have done from a treatment perspective, because Eden is unmedicated. She tried medication once. She was like, absolutely freaking not. And Dan, you've been medicated at different times and then in different pockets. And you are now medicated. You've been straight for 2 years on Adderall, right? You think it's been less?
Yeah.
Okay, so let's talk about the medication experience, because a lot of people with ADHD are like, oh, I don't want to take medication. It's gonna this, it's gonna that. They freak out about it. So let's talk about the reality of it.
Yeah, it's gonna this, it's gonna that. I mean, I took Adderall for a period of like 3 or 4 months when I articled, because there was anxiety about articling. Which is it's like an apprenticeship before you become a lawyer. I don't know if I can recall the level of impact or not impact it had, because it was so long ago, but there was a desire to test out medication at the suggestion and discussions that I had with my wife. I decided to take it. I think it's been about 1.5 years. I think it started in the fall of 21, I want to say. No, the fall of 2020.
Right. And also we like, I want to mention, because everyone's listening, that we did try other treatment protocols before from a natural medicine perspective. And the trouble for you was actually sticking to the protocol, because it's a lot harder.
I was just about to say part of the problem is associated with me is that lack of follow through or the forgetfulness, right? But medication has immense benefit and a lot of detractors. And on the balance of probabilities for me, it's been good. I'm still weighing on whether I want to continue on with it or try something else. You get intense periods of hyper focus. And that is, for my particular profession, which is extremely high demand and high stress, is very helpful, very functional for my career. The downside of it is there's a huge swing on the opposite direction. I probably developed far worse sleeping patterns than I had before, and I didn't have good ones to start. There's almost a bit of manicness that comes with it. Like such a high level of intensity at times
Yes.
that it's not a controllable thing. You're not aware of it, and it rises to a pretty high level. But like all things in life, I think there's probably some very, very positive components of it, and some things that are probably not so good.
Eden, what was your experience with medication?
Yeah, so I can count on one hand how many times I did try medication. I was prescribed Concerta, I never took it, but I was struggling in my last year of university around exam time, and I said, you know what, I'm gonna try Adderall, and I made the mistake of taking an Adderall, but I had a extra large green tea that morning, and then I had the Adderall, and that day was fine, but within 24 hours, the next day I had an extra large green tea in the morning and another Adderall, and I swore to myself after that day that I would rather fail my exams and figure it out than have to go through the sensation I had. I will never forget. I don't know if it was like too much caffeine and everything going on, but I was sitting at the library and I got really flat. I had this feeling like I could go like Usain Bolt down to the other side of town, and like you had to keep me in a cage. Like I was so on edge and flush and panicky, and I went with my friends in the bathroom, and she was in there for a long time. Small bathroom, couple stalls, and I spent half an hour pacing back and forth and splashing water on my face. Like it was such a like I felt like I was gonna go like I hate to say
Dan's about to
So-
tell you that he went through this too, but you had to get through that.
Listen, again, so temperature regulation, things like this, very common, super common. My understanding is the first week, 2 weeks, even 3 weeks has much more pronounced symptoms associated with medications. My understanding is that once you become accustomed to it, that's when it starts to have its impact. I was told you have to do it for at least 2-3 weeks before you can even make an assessment about whether or not it's even effective.
yeah.
And that is a testament. This is also a testament to Dan's ability to sit through discomfort with the skills that he has a lot more than you, because I want all of my listeners to know that Dan is like a huge lifestyle mental health buff, and we're gonna just quickly cover how involved he is with yoga and meditation, how big of a role that played in his life when it came to the ADHD, and how he learned to actually sit through the chaos so that he knew that he could get through it on the other side. Eden is more of the emotional, impulsive, like sit to do something. She's like, nope, don't like this. And then she's out, right? So Dan flexed that muscle and worked that skill with a lot more intensity than you ever have, which is what allows him to get through opportunities like being uncomfortable on medication for 2 to 3 weeks until he reaps the benefits versus bailing.
I'm just going to tie into that because Eden's emotional volatility, which I am very, very familiar with, is something that I suffered from as a child. So I was a very, very emotionally dysregulated child. Angry outbursts, frustration, all of these things. I feel, even now, I feel things really intensely. I feel love very intensely. I feel happiness very intensely. My feelings are intense. But the negative association that I created with negative feelings, so the negative feelings being ones that I've called negative, anger, frustration, jealousy, these are feelings that I did not like and I wanted to obliterate from my being. I've now come to understand that they're non-obliteratable, but they are certainly defeatable. So I spent a very long time working with meditation, with yoga. Meditation in particular teaches something that is required in order to overcome everything, and the underlying component of that is discipline. And I am very emotionally regulated for someone with my condition, and I would say even for someone who would be considered emotionally regulated.
Totally.
So
I need to interrupt you because Eden has to hop off because she has a meeting right now. So me and you are just going to continue the chat for just a few more minutes. Thanks for coming. Because I do want to cover some stuff about the natural medicines that we tried. And, what can be helpful if people are willing to stay the course, and how it was challenging for me to treat you, because obviously you're my husband and I can't really be a doctor and a wife at the same time, because it creates a weird dynamic and left me disappointed when you wouldn't do the things which a doctor's not supposed to have any emotional connection to. So the yoga and meditation obviously played a giant role for you. You were able to manage your symptoms while you were unmedicated because you were doing all those things. You were going to the gym, you were meditating, you were doing your breath work, you were doing your, did I say yoga? Yes. Like you were doing all the things that you needed to do from a lifestyle perspective in order to process the feelings, in order to not obliterate the frustration and that type of, in that way, but you were able to sit with it because you had all these other practices going on. But then as life picked up and your interests changed, or your desire and motivation to continue doing those things changed, the treatment plan had to change too, right? So
Yes.
there's a way, and I want people to understand that for those who have ADHD and want to deal with the real symptoms that they have without being medicated, you're going to have to put a lot of effort into other areas in your life, which I always tell people with anxiety and depression, you need to put that effort in regardless if you want to be able to achieve that happiness and the goals that you have and living the life that you want. But it's really important for ADHD because it's your way of processing. And if you're not learning what that is and aware of it, then the whole mental health condition takes a tailspin on you. And then things are going to happen that you don't want to happen. You're going to be like, I don't know why it's happening. And then, we end up with problems, and then people coming to me being like, what do I do? So I think that the best of both worlds for you would obviously being, doing all of the things, but your life doesn't allow for that right now.
Correct.
So it's not, I don't think that this is one of those conditions that has to be dealt with unmedicated. I think it requires a shit ton of work if you want to do it that way. But I mean, you outlined the downfalls of medication and what it takes to actually get through that period to feel if you like being on the meds. So
I would note that I would not be on the medication, and I would never elect to be on the medication if I wasn't in the type of job I am. So, my understanding is you can get on and off the medication to the extent you make a choice to do so. So within reason, within long periods of reason. But because of the type of job I have, because of the type of expectations that are on me in order to be successful in my role, in my profession, which provides me my income and my ability to provide everyone else the things that I want to provide them, it on the balance of probabilities for me as an individual, it is a risk reward that
right.
I'm willing to take. If I was doing a profession that had far less expectation, stress, and need for prolonged periods of intense focus, I would not be on the medication 100%.
And you would be leaning toward staying with the gym, yoga, meditation, breath work, that kind of stuff?
100%. Mm-hmm. But I've made a choice. I mean, my days, I have 10, 12, 14-hour days of expectation, where if you don't have that, if you have a 3 or 4 hour burst of expectation, in my opinion, you would be far better off working with meditation, yoga, naturopathics, exercise, because at that point you're able to do far more. I'm in a very extreme example of someone taking medication.
Yeah.
If I had my choice, I never would, and I never would again.
Well, yeah, I mean, we were like, I think we've been together a lot longer with you off medication than we have with you on medication.
Yes, yes, of course.
So, and you know what, we also have seen some improvements to like the emotional and behavioral components since you did start taking meds. Like we did see changes. It wasn't just in focus and concentration and work. There was an overlap to the like the emotional focus that you had, or the motivation and execution in relationship. I mean, at least that's my experience of watching you. So, I mean, when you go off medication, just let me know, right? There's one more thing that I want to talk about. Obviously, I wanted to talk about more things like overlapping personality disorders and stuff with ADHD, but we didn't really get to cover that today. But what I do want to talk about is a very big symptom that people with ADHD have that they don't know that they have. And that is rejection sensitive dysphoria. And we've talked about it so many times, and you hate when I bring it up. So can't wait to piss you off while we have a few minutes left of this chat. But for those of you listening who don't know what rejection sensitive dysphoria is this perception that you are being criticized, or that you are being put down, or that you are being reprimanded or left out, whatever it is, to such a heightened degree that it's actually happening. And I think that we've noticed it a lot in relationship. I've always like tried to point a finger being like, that's your rejection sensitive dysphoria. I'm not saying it that way. I don't mean it that way. But the experience for you is just as real as if someone was putting you down or was rejecting you or was criticizing you, and you feel it inside of you to the point where there's an emotional reaction to it. So it's hard to say, I think, because you have your perception in your brain. Your brain is your ADHD brain, which feels the rejection sensitive dysphoria. But can you ever have a moment where you step away and you're like, maybe it was that, or it could have been that, or something felt exacerbated because of that, from an emotional standpoint?
I mean, yes and no. I mean, even hearing you describe it that way, there's a mild emotional reaction, because what it's suggesting is that the emotional reaction to the rejection is not justified. So when it's happening, absolutely, whether it's proportional or disproportional, it is 100% justified. My degree of validation and justification of my own feelings in response to the impetus, whether it was in fact unjust or unnecessary criticism or unjust or unnecessary rejection or not, is irrelevant. So at the time, however I feel it, I feel it.
Yes.
Now, now on reflection, usually, and I'd say in most cases, particularly when it comes to you, because of the degree of love, respect, like you don't fall into the oppositional defiance disorder category for me because of who you are. And oftentimes,
thank God,
I do reflect, and I am capable of, if not acknowledging the extent to which it was disproportionate, and returning with either hat in hand, apology ready, or willingness to move on. Even when that isn't the case, it will eventually arrive. And then in the moment, but the problem then becomes is in the moment where it is justified, when the rejection or the criticism was misplaced, or was over the top, or was a symptom of your own or somebody else's own pathologies or problems.
How do you tell the difference? Yeah.
The problem is navigating the individual in that circumstance.
Correct.
Because the individual will often fall back on, you are the one who has this issue. You are the one who constantly comes back to me and apologizes and says, maybe I myself had overreacted. It alleviates the person from taking responsibility for when they have unjustly or unnecessarily let their own pathologies result in some kind of negative behavior toward the person who suffers from it.
And just one more thing to add, because I do love talking to my patients about this. When they do bring an ADHD diagnosis, or they do bring a personality disorder diagnosis, especially borderline, which has a lot of overlap with ADHD. Again, we won't cover it today, but what we see in the research is that people with that neurodivergent type of brain, they actually see faces differently. So they've done research where they show pictures of people's faces, and they will get the patient to describe what it is they feel that the person is feeling or experiencing based on the picture or the vision of their face. So when they did the research with rejection sensitive dysphoria, it was the people that had that symptom would read faces and read body language differently than the average person. So if they were doing a randomized clinical control trial, that people without ADHD brain would be having a very different perception of the face and the body language, and they would have a different verbalization of what it is they were seeing. So that's kind of interesting, right? And of course, we don't just plaster symptoms on people and say, this is what you have, and like that's what's happening right now, and that's what's aggravating your emotions. And we try not to just label people with things, but we have research to provide us some insight that people with a neurodivergent brain are actually experiencing emotions and body language and tone of voice and all that kind of stuff differently than the average brain. Are you having an ADHD moment?
Wow.
All right. Yeah, so I'm thinking I'm gonna park it there for now, because again, we don't have Eden anymore, and I feel like we've shared a lot of information today. If people like this chat on ADHD, we can keep bringing more to the table. I would, if people are interested in hearing about the personality disorders and how they can be happening at the same time as ADHD, how they can get misdiagnosed, I can do another live on that. But it was a pleasure having you join me today, and we'll give Eden a little ghost goodbye. Thanks for joining me. And if anyone has any questions, please feel free to send me a personal message on Facebook. If you've listened to this whole video and podcast and you want to learn more, message me. Tell me what you need to learn. Tell me what you want to know. And I will be able to hopefully provide that as soon as possible. Okay? Anything else, Dan? Any last words?
Thank you for hosting.
All right, folks. Speak soon. Thanks for joining the live if you did. And if you're watching this after, thanks so much for listening all the way through. All right, peace out.